Alright, so here we arrived to a 23-year-old male patient who is suffering from epistaxis. So the bleeding has been ongoing for about 4 hours according to the patient. So while the patient here, we have him. Hey, I'm just going to introduce myself, gain consent, and begin treating and intervening. So, hey, my name is Faisal. What's your name?
My name is Damien.
Hey, Damien. So, can you tell me how long this nosebleed have been going on for?
Like 3 to 4 hours.
Okay. And have you been sitting here, or were you doing other activities?
No, I was just sitting here playing some games.
Okay,
Yeah.
so were you in this particular room? Okay,
Yeah.
so from what I can realize, the room is pretty hot, especially since the gaming console has been going on for a while, a couple of hours. I've noticed you also have a fan going on in the background, but that does not actually exclude the overall heat temperature that's in the room. So Damien, I'll just get you to clap your nose right so. Yeah, just apply a lot of pressure. That's good. And while he holds it there for 15 minutes, I'll just go through a couple of questions with him. And if the bleeding did not stop, I'm going to have to intervene through using pharmaceutical interventions. So, Damien, have you had any trauma or any impact to your nose? Okay, have you been kind of picking your nose roughly or playing with it or anything? Okay, have you done or underwent a surgical treatment or something in your nose? Alright, do you have any sinus infection? Have you been generally well in the past few days or few weeks?
Yeah.
Okay, do you know if you have hay fever by any chance? Or?
No, I don't.
No. Have you been blowing your nose really hardly or been sniffing pretty roughly?
No.
No. Okay. Well, so far so good. Just one more question. Obviously, have you been taking or using any recreational drugs through your nose?
No.
Okay, so that includes cocaine and stuff. Okay, so since nothing of these have popped up, I'm just gonna now assume that 15 minutes has been up. So I'm just gonna look at the patient. Can you stop? The nosebleed has not stopped and it's still dripping. Can I just get you to go back on it? So since bleeding has continued, we're gonna just take him. I'm just gonna look at my treatment reference, which is gonna be adrenaline with sodium chloride, which is 0.5%, at ratio of 1:1000. So I'm just gonna bring up my joint appeal. I'm just gonna attach my syringe. I'm gonna shot check. So this is adrenaline, 1 milligram, in expired in 2017 March. So I'm just gonna shot check.
Actually, 1 milligram, 5 March.
Great. So Damien, can I please get your hand off your nose? And since the nose has not bleeding, can I just get you to blow really hard so you can clear your nose out from anything that's obstructing it or blocking the way? Good stuff. So now I'm just going to be administering 2 mils at each nostril. So what I would like you to do when I squirt it in your nose, just inhale deeply and try not to sneeze, okay? So on 3, 1, 2, and 3. 1, 2, and 3. Perfect. So I'll just get you to hold it again, like so, and just try not to sneeze. So while my patient is holding his nose, I'll just go through my action plan and what's going to go with the patient. If the bleeding has stopped after this general treatment, and since he's not in any anticoagulant or or blood thinners, I'll 35 him and leave the patient at home, and I'd recommend him to go see the doctor after a few hours if necessary, or if he likes to. However, if the bleeding has not stopped and he's not an anticoagulant, he needs to go and see the GP within the next few hours. And if he's an anticoagulant, then we have to take him to ED. And if the bleeding did not stop after this general treatment, he's not on any anticoagulant medications, he needs to go see his doctor. And if he is on anticoagulants, then he has to go to ED with us through ambulance. And so, assuming it's 15 minutes by, can you stop? Is there any nosebleed or anything? No, that's great. So since there's no nosebleed, I'm just gonna leave Damien here with a clear instruction of what's gonna happen from now. So Damien, what I need you to do now, since the bleeding has stopped, I need you to try and stop from taking hot showers, drink warm beverages, or try and play with your nose or blow really hard to stop moving any clotting materials that gonna stop the bleeding here. Okay? So if it happens to bleed again, feel free to call us if it was severe, and if you couldn't go to the hospital or anything, just feel free to call us again. If you have any, do you have any questions? Great. Alright, so we were dispatched to a 23-year-old male patient who was complaining of pain in their lower back. On arrival, just introducing myself to the patient. Hey, my name is Faisal. What's your name?
My name's Damien.
Hey, Damien. So what seemed to be the problem?
I was lifting some furniture and this morning and it's starting to hurt now.
Right. So, well, from what I've heard is there was some active mechanism that hurted his lower back with what seems to be there was a popping noise or some sort, and it was just got really bad as he was lifting really heavy stuff. Well, do you know if you have is the pain radiating anywhere else right now?
No, it's just in my lower
Just
back.
in your lower back. And does it get worse when you move or use your back and stuff, or?
No, lying like this.
So resting like this decreases the pain?
Yeah.
Okay, that's good. And as you said, there's no pain radiating anywhere else, right?
No.
Right, so I'm just going to quickly grab a quick set of vitals before I begin my physical assessment and secondary assessment. So just quickly going through my vitals. All my vital signs seem to be within the normal range, so that would be good. So now I'm just going to be palpating you, Damien. Is that okay?
Yes.
So I'm just going to expose the back a little bit to see if there's any obvious signs of trauma or injury. There's nothing that I can see, so I'm just going to slowly palpate down. And can you tell me when you feel the pain? So I'm just palpating. So is the pain around?
Oh, yeah.
So is the pain around here?
Yeah.
Yep. So is it radiating anywhere else?
No. Just.
Okay. Is it radiating here? Does this feel normal or am I ordering?
It feels pretty normal.
Okay, so when I slide my finger across your skin, does that feel normal?
Yeah.
Typical, as you always find it?
Yeah.
Correct. Can I get you to raise your right foot up against my hand? Good, that's a good pressure. No, your left one. Good. Can you do both at the same time? Great. Can you do a TV for me? That's good, that's good, that's great. Do you think you can bend your legs? Good stuff. Is there any pain there?
No.
Okay, can you put them down? Does any of it feel a little bit off than it usually was before the pain came on?
No.
Okay, that's great. So I'm just going to also quickly palpate around the neck. There's no pain there, is there?
No.
I'm just going to palpate around the chest. Do you feel anything there?
No.
Okay. So there's no pain radiating anywhere else except for the local pain localized right there. So since all the vitals are normal and everything, and there is nothing else that seemed to be major of concern, what I'm going to try is to get Damien here to stand up and try and walk and see if he's able to walk or not. So Damien, can I just get you up so we can see if you're able to immobilize? Can you just walk from here to there? Can I get you to walk back? So what I'm checking for is I'm checking that he's capable of walking, he's not swinging around, or does it feel pain? Is it bad to walk? Do you feel any pain at all?
No pain.
Any weird sensations?
No.
Any numbness or tingling?
No.
Okay. So since there's no numbness or any tingling or any other signs that indicate something else or more major than what it is at this stage, has been excluded. So what I'm going to be doing now is I might be administering some pain relief. So some of the pain reliefs that I'm going to be administering to Damien would be depending on his weight. Okay, so we can base off the dosages. So how much do you weigh, Damien?
I weigh about 90.
Okay, so since he weighs over 80 kgs, we're going to be administering 1.5 grams of paracetamol. We're going to administer 600 milligrams of ibuprofen, and we're also going to give him one tablet of 50 milligrams of tramadol, since he rates the pain when he's moving that's pretty high. So I'm just going to go through the checklist now. So, have you lost any control if you go number ones and twos after the pain has gone, or are you still able to go whenever you feel like it? That's good. And so temperature has to be greater than 38 to this due to sepsis or infection, presence of infection. In this case, it's not the deal since his temperature was within normal range. Rigorous, oil sedation does not appear to be so. Abnormal vital signs, that's excluded. Pain in the thorax, spine, or chest, we have palpated this and thus eliminated that. Abdominal pain or tenderness, we have also palpated this, and there was no pain or tenderness anywhere except for the lower back. Altered sensation and or palpity both legs, we have seen him being able to mobilize and walk freely without any additional pain rising through walking. Unable to walk, that's been eliminated. Signs and symptoms of general illness, no, he's generally healthy. Pain radiating down both legs, that's been eliminated as well. So now we go through our orange checklist, or orange flags. As you said, you have not had any cases of cancer before, is that right? So we have checked if he has any immunocompromise, such as steroids or chemotherapy medicines, and he's not. So does the pain worsen when you're lying down, or no?
No,
It gets better. So that, or at night, does it increase at night times?
No.
No. Okay, so have you recently lost a lot of unplanned weight or dropped in weight?
No.
Okay, and as you said, there's no pain radiating anywhere, and the patient does not seem to have osteoporosis, and he's not seem to be IV drug user, and he's competent and aware of what's happening around him. So now we're just going to go through our green flags. Still pain or muscle spasm isolated to the luminal area, able to walk, and normal vital signs. So since he's only in a green flag, what are we going to do is we only going to be updating pathing you. If the pain did increase or gotten worse or started radiating anywhere else, or you felt generally worse than what you did before, feel free to call us again. You should probably go see your doctors next 24 hours whenever you can, and get that generally checked up, see if there's nothing wrong, x-rays, just to make sure there's nothing actually is wrong